In this episode of INN CEO Talks, I'm joined by Andrew Norton of Bloom Health Partners, and we're talking about operational health. Andrew, welcome back.
Great to be here. Thanks for having me.
Operational health, people will go, what is that? And as we explain it, what's the most important thing that you want potential investors to take away from this conversation as they consider Bloom Health Partners for their portfolio?
Bloom Health Partners is right in the middle of what I would categorize as a generational opportunity around what I call employee health. Employees are now at a premium. It's very difficult to find people. I think across all industries, employers are struggling to both retain and attract employees. And they're not starting to see that healthcare is a way to do that, to achieve that goal. Bloom is right in the middle of their services.
Okay, so then how do you do that? Like, what is it that you bring to those companies so that the employee feels that they're getting what they want, but the company is also then meeting those healthcare needs of their team?
And what we're bringing the employee via the employer that's offering the services is the ability to now get healthcare on site at work. So if it's an American company, things like insurance premiums and deductibles are no longer required. And more than that, the employee is now feeling engaged by their employer. You know, the modern employee, time and time again now, is stating that in surveys we're seeing across the board, that they value perks and benefits over just salary. And I would argue that nobody ever wins a price war. You know, so if you just continue to raise your salaries and increase wages, you may not necessarily achieve what you're looking for as an employer. But if you start offering services that engage employees, then that's a win.
So how do you go about doing that? Like, how does that roll out for a particular company? You know, let's say your client is a major auto manufacturer or an airline company. What is it that you bring that is like on the ground that works for the company and the staff?
Well, the kind of stuff employees tend to associate healthcare at work with, because, you know, the idea of having which traditionally been called occupational health. I think last time I was here, I talked about how that's really something that hasn't changed in a couple of decades. We're innovating. So we're bringing things like screening, proactive healthcare. So the idea is that an employee now has an accurate private picture of what their healthcare situation is, whether they've got diabetes or maybe it's a cardiac situation, that kind of thing. Well, that employee now knows this, and it's all been handled by the employer. The employer doesn't know. But what they do know is how many people have done tests and how many people have actually participated, so at least they can do some risk profiling on understanding how viable their business is. But the employee gets, for the first time ever, is a relationship with their employer around their own personal care. And that's a very new concept. And you talk about an auto manufacturer, and a laborer, an hourly worker, they traditionally have had nothing like that. Traditionally, healthcare work is, taping somebody's elbow and fixing somebody's hurt knee. Very reactive. Very much what I like to call the school nurse station. This is a lot more advanced, and it brings a lot more to the employee at a time when they're demanding a lot more from their employers.
So are you in essence creating a new space then in the healthcare provision to companies? And if so, how do you explain what the differentiator is between you and any of your competitors?
Differentiator between us and our competitors, to answer that backwards, it's our willingness to innovate and our technical focus, because we're both innovating with new kinds of treatments and new kinds of tests and screening measures and things that employees will only benefit from and employers can now offer as a real differentiator. And the other component of this is the digital component, because now the employee has an electronic record of their health situation, and the employer, what they get is essentially an anonymized view of how many people have tested, how many people have visited the center lately, and at the very least know how much risk their operation runs. If you have, for example, a lot of employees that have, early signs of type 2 diabetes or obesity and those kinds of things, well, now employers can start making choices in areas as simple as changing up the vending machines, all the way through to maybe rolling out wellness programs to just provide a better quality of life for the people that work there.
The last time we talked about the fact that Bloom Health Partners was helping to address some issues with regards to dealing with COVID-19. Where are you going now?
Where we're going now is well into what I just described, which is a much broader approach to workplace health. What COVID did is show us if nothing, that there was a giant gap in healthcare. Now, as a growing company, we can do some very innovative things. We can't go and change the system, and we're certainly not looking to compete with hospitals and the established system. We're simply extending care in areas where there's a huge need at the moment. The need across the board to, at the very least, attract employees and retain employees is settled a really exciting business plan for our business. We've proven ourselves in some of the biggest companies in America through some of the toughest times in COVID. And now they've all come back to us saying, we'd like other programs because you've proven yourselves. You're a trusted vendor here.
Give us an idea of how well you're doing. I know that you've just had some recent financials. What did they state?
So our Q2 financials, we reported 11.1 million Canadian dollars for the second quarter. That comes with a $2.1 million EBITDA. So pretty good for a second quarter business. That puts our year to date now for the first 6 months of the year, or 2 quarters, as of March 31st, at $16.9 million Canadian dollars. And that's against guidance that I put out earlier in the year of between 25 and 28 million Canadian dollars. So we're tracking nicely, and we're executing on the plan that we promised investors and our stakeholders.
So for a lot of people who are watching right now, they might go, okay, well, that sounds great, Andrew, but just what is the scope and size of this healthcare market that you're moving into?
So the traditional occupational health market was 6.5 billion US in the United States last year. That's just one country and one number. And that excludes a lot of the services I'm talking about. So just the traditional healthcare business, of occupational health, which really hasn't changed in decades, that was 6.5 billion. We think it's much larger. I've heard numbers of the overall healthcare number being in the trillions in the United States. I think that if you look at the addressable market in the years to come, especially if you add things like proactive care, mental health, or behavioral health, which we call it, that probably doubles that number in terms of the total addressable market. So Bloom is really embarking on new territory and redefining a category, and growing that category as a result.
So you're expanding market. Are you expanding your team as well?
Yeah, absolutely. It all comes with growth, and it comes with the right people. So back in the first quarter, we added a new chief operating officer, Rosemary Elston. She comes from Cancer Treatment Centers of America, also had senior roles at Kaiser Permanente and Wellstar Health. We're now adding some more people to the team on the executive side as well, which are some of the very exciting announcements about who we're adding, and more professionals on the ground, which is a big part of this.
Pretty exciting time ahead, isn't it? And, I'm fascinated to see where you grow, what areas you move into, and I'm hoping that you'll come back and give us an update shortly.
Certainly look forward to it. Thank you.
Wonderful. Thanks for your time today.